If you have an uncomplicated pregnancy, then air travel is generally considered safe. Generally speaking, after the first trimester, so around week 12, 14, people are starting to feel better. They have much less nausea. If they had any kind of symptoms like spotting or bleeding or cramping or fatigue, then it's generally improving by the second trimester. So people are feeling a lot more energized usually, and they're feeling more like themselves. This is a good time to travel before the baby comes. Most airlines allow you to fly until week 36, but it is best to check with your airline company. After week 36, I think most airlines don't allow you to fly because there is a higher risk to go into labor, which is not ideal on an airplane. There are urban legends saying that if you are born on an airplane, then you may be granted citizenship for the flight space that you happen to be in, but as far as I understand, your nationality depends on your parents' nationality. Usually you don't need to take any kind of special precautions for 1-2 hour flights other than just being comfortable and staying hydrated. For longer flights, like 10-ish hours, it's recommended that if it's possible, then you might want to book an aisle seat so you're able to get up, stretch your legs, do some little exercises, be able to go to the bathroom. It is very important to stay hydrated, to wear loose-fitting clothing, and depending on your symptoms or if you have any, and discussing with your doctor, maybe it's recommended to use some kind of compression stockings as well. If you have a high-risk pregnancy, like if you're at high risk for preterm labor, if you have any recent vaginal bleeding or any known cause that makes you qualify as a high-risk pregnancy, or if you have any underlying health issues that may put you at risk to fly pregnant, then it's generally recommended to avoid. But it's always best to discuss with your doctor. Pregnancies with gestational diabetes or high blood pressure don't necessarily qualify as high-risk pregnancy in regard to being able to fly or not. If you take medication regularly, it may be wise to have a note from your doctor saying that these are your regular medications that you are required to take. And in some cases, some airlines may ask for a fit-to-fly note. For people who are planning to fly during their pregnancy, I generally recommend booking an aisle seat if it's possible, maybe a seat with extra leg room, being able to get up, do a little bit of exercise, stretch your legs. I recommend putting the seat belt low under your belly so that there's not any kind of uncomfortable compression. And in some cases, it can be recommended to use compression stockings.